Welcome everyone. My name is Daniel Calder. I'm the Citywide Wellness Coordinator at WorkWell NYC, and you're participating in our Caring and Coping series. So usually we have a health fair this time around in person, but unfortunately we can't. So we still want to provide city employees the opportunity to come, learn about the numerous wellness resources in New York City, and to chat with representatives from those vendors. So today we're doing our virtual health fair, vendor fair with Cancer Care, Thrive NYC, Emblem Health, and NYC Well. Before we begin, just a little bit about WorkWell. I'm sure most of y'all know about WorkWell by now, but just a reiteration, WorkWell NYC is NYC's workplace wellness program. New York City employees serve the city every day, so our aim is to serve city employees. And our mission is simple: to create workplaces that engage and empower employees to live healthy, active lifestyles. As you can see, we have 4 areas that we concentrate on. Move More, which is all about physical activity. Eat Well, which is about healthy eating. Take Action, which is about primary care and prevention. And Be Well, which is all about mental well-being. So as I mentioned, today we have Cancer Care, Thrive NYC, Emblem Health, and NYC Well. How it will work is each representative from the organization will do about a 5-minute presentation, guided by some slides so you could all view and see what they're talking about. And at the end, we're gonna do a live Q&A. So throughout this presentation, submit your questions in the chat box and we'll do our best to answer any questions that you have. In the chat box right now, we're dropping a link to a shared Google Drive. And in that Google Drive, we have all the different vendors, a folder for each, and we have the presentations in that. We have the resources that they provided. So the resources that you would go to a table and get, it's in that folder. And then also, we also had a 1-pager, which is all the contact information. And we're also gonna put that in the chat. So if we don't get to your question, we have the contact information for our vendors today, and you could reach out to them. Okay, with that being said, let's go into our presentation. So first we have Cancer Care, and we are represented by Patricia Goldsmith. Patricia joined Cancer Care in 2014 as its Chief Executive Officer, bringing 20 years of nonprofit management and strategic planning experience. And she previously served at the National Comprehensive Cancer Network and H. Lee Moffitt's Cancer Center and Research. So she brings a lot of expertise, and we're really glad to have her today. So Patricia?
Thank you very much. And you can go to the first slide, please. It's a pleasure to be with you today and have the opportunity to share with you what I consider a gem and a great resource in New York City. So just by way of background, Cancer Care is a 76-year-old organization based in Manhattan, but also with offices in Long Island and New Jersey. We serve anyone who has been impacted by a diagnosis of cancer, meaning the cancer patient themselves, the caregiver, the child, the parent, the bereaved, and the coworker. And everything that I'm going to tell you about today is available to you and your colleagues free of charge. Cancer Care has what I characterize as 6 pillars. The most important, I think, is the heart and soul of the organization, and that is that we employ over 40 master's prepared oncology social workers that, with rare exception, are the first point of contact for anybody that is reaching out to Cancer Care. Those individuals are there to assist in many ways, to provide counseling. Used to be pre-COVID, face-to-face. Now everything is virtual and online by the telephone or by Zoom, etc. We provide counseling, support groups, many different types of services through the social worker. We also have a very robust program of Connect Education workshops that are available live via WebEx and are archived on our website. Typically, we offer 75 of those per year that focus on disease-specific areas, symptoms, side effect management, understanding the Affordable Care Act, helping with bereavement, etc. Out of those come over 300 publications in print and available online that are a resource and great guide for many, many practical types of information around cancer. We also have a very robust program, many different programs to provide financial assistance and for individuals that may need help paying for their medications, may need help with transportation, housekeeping services, pain medication, childcare services, and we typically distribute over $50 million a year in financial assistance. We have many community programs. We would be there today in person were it not for COVID that are offered in New York, New Jersey, and Connecticut. But I emphasize we are a national organization available to anyone impacted by a diagnosis of cancer. If you can go to the next slide, please. I'll share with you a little bit about our impact. We're actually just finalizing our statistics for this fiscal year, but just to give you some idea, we served individuals directly served in all 50 states with 96 different types of cancer. We have a very robust website that welcomed over 2.3 million visitors to the website. We fielded 70,000 calls to our Hope Line last year. I also want to tell you about a program that I am very proud of, the first like it in the country, and that is we have a program to help cancer patients in active treatment keep and maintain their pet, psychosocial support, education, and financial assistance. At the end of June, we had helped 617 clients with financially supporting their pet, and that was with the launch that just occurred in March. I mentioned those education publications. We also have a platform that is very, very widely used by cancer patients called My Cancer Circle. And it's available for you to build a community and invite individuals into your community to be able to provide updates about yourself, your family, to also ask someone if they could perhaps bring dinner on Friday night or pick up your child from soccer practice on Wednesday. And then one of our most robust publications is our Helping Hand Guide, which is a compendium of resources all across the country to help individuals that have been impacted by cancer. And you can see that we had nearly 70,000 searches in 1 year alone. And then, of course, those robust Connect education workshops that I told you about. If you go to the next slide, please. I think it's very important that you know a little bit about the heart and soul of cancer care. Unlike many other organizations since the pandemic, we've actually hired people to accommodate extraordinary volume. We now have over 40 master's prepared social workers within cancer care. Anybody can receive counseling from us, whether that be the patient, the caregiver, the newly bereaved, children. Now, of course, with COVID, some of our services have changed so that they're no longer in person. But it's important that you know what a social worker can do for you. They can first support you in many different ways through your cancer diagnosis, help you to manage stress and anxiety, help you to really increase feelings of hope and feeling empowered, find novel and creative ways of coping with your diagnosis. Importantly, help you to communicate with your care team and your loved ones about the things that are important to you as an individual. Provide very practical resources and information about your treatment and provide many resources that are available to you within your own community. The next slide, please. We also have a relatively new program that is extraordinarily popular, and that is case management. What we do is have trained social workers that are there to help anyone who calls in to get practical guidance and information and find tangible ways to help you cope. This is a service that is available over the phone. We have Spanish-speaking social workers available. We also have a service that can translate in real time in many other languages. So this is available across the country. You can see our Hope Line hours right now are Monday through Thursday, 10 a.m. to 6 p.m., Friday, 10 to 5. We are looking at expanding our hours. And you can go to the next slide. So that's a little bit about Cancer Care as an organization. I want to emphasize to you that we are here for you and here to help and support you if you've been in any way impacted by a diagnosis of cancer. Thank you.
Thanks so much, Patricia. That was really some great information. We're going to go through the other presentations and we'll have some follow-up questions. But in the meantime, if you had any questions about what Patricia just said, feel free to put that in the chat box and we'll address that after all the presentations. So next we have Thrive NYC. So I'd like to introduce Kala Ganesh. She's the Director of Community Engagement at the Mayor's Office, Thrive NYC. And Kala has a lot of experience in the fields of mental health, refugee resettlement, rural development, and gender justice. So she spans many areas. So happy to introduce her and to have her speak about Thrive NYC. Kala, if you could just unmute yourself.
Okay, common problem. Thank you, Daniel, and thank you everyone for being part of today's presentation. We welcome you to it. So Thrive was launched by First Lady Shirlene McRae and the mayor in 2015, and it tackles critical gaps in our mental health care system and activates every part of city government to promote mental health. Thrive is an unprecedented commitment across 12 city agencies to implement over 30 innovative programs that currently reach hundreds of thousands of New Yorkers each year. We reach people with the highest needs. This is those with serious mental illness, those harmed by trauma, and those currently living in historically underserved neighborhoods. And we eliminate barriers to care for all New Yorkers by providing free services in over 200 different languages, regardless of insurance or immigration status. All of our programs actually advance 4 critical goals. They promote mental health in the youngest New Yorkers. They reach people with the highest need. They strengthen crisis prevention and response and eliminate barriers to care. To know more about our programs, you can click on our website and you will be able to get details not only about the programs, but also the close to 200 community-based organizations through which these programs are implemented. Thank you, Daniel. Move on to the next one. Okay, so like everybody else, I think during COVID, Thrive put out, we put together actually a list of resources that all of us can access while we are at home. These resources not only pertain to important mental health related issues, but they also have information about other services that people could access while they are at home. It has a panoply of services that include how to get food, elder abuse, mental health services, so for seniors. So it includes a number of other services that are in there. And this is a wonderful resource for every one of us who is at home, but needs support for mental health and other things in our life. Okay. So on the online guide, we're recommending that you look for a little category that says city government employees. And there you will find specific resources that address what may be pertinent to you. Other than that, we also had, as part of that, we also have guides and coping tips that may be very helpful for city employees, including grief and loss in the workplace during COVID-19, burnout at the time of COVID-19, how to improve sleep habits, acknowledging psychological trauma, and many other things. So please look at these resources as you may find them really helpful. Okay, so one of the things that Thrive does is that we work in partnership with city agencies. So we support city agencies to actually take care of the mental health and well-being of their employees. So in collaboration with OLR, we did put out an extraordinarily important mental health guide. It's actually for employers, but it's also for employees, about really removing the stigma associated with mental health, ways in which we can normalize conversations around mental health, how to support employees who may be going through some struggles in their lives, and how to connect people to care. So you can download this guide on our website anytime you like. And it has a lot of concrete tips and topics that are addressed, including burnout and vicarious trauma. So this guide actually came up was created by us having conversations with a range of city employees. We had conversations with leaderships, with managers, with city staff to really better understand the vicarious trauma that they were facing as part of their jobs. So this guide is also focused on strategies to mitigate some of the vicarious trauma. In addition, we have Thrive in Your Workplace, which is a public-private partnership and really talks about ways that employers can create workplaces that support the mental well-being of their employees. And they put out a number of relevant webinars, which are also viewable on our site anytime you like. One of them is promoting mental health in the workplace during COVID. There is one that's really important that all of us can listen to, which is really understanding and addressing collective trauma from COVID. This is something that every one of us is facing right now. In addition, we have something to talk about how to foster an anti-racist workplace practice for mental health. So there are a number of webinars of that kind that you can access by going onto our website. Okay. And I have a colleague here from NYC Well who will talk about more detail about this, but NYC Well is also a program that's supported by Thrive. And as you know, this is a single point of entry for every New Yorker who's looking to get mental health support. And we'll hear more from my colleague when she talks about that. So I'm not going to focus on that for the moment. In addition to this, we put out a number of resources for New Yorkers that are on our website and are really, as you can see, specific to certain situations or age groups. So for anything concerning aging New Yorkers, you can, there are resources for that, for veterans, for anyone harmed by violence, crime, and abuse, students and young people. All of these are relevant to every one of us because we may have family members who are veterans or who we may be providing care to our parents, community members. So all of these websites, I think you can go to all of these resources and find out much more detailed information about all this. These are all mental health resources that's available for every New Yorker and free of charge. Thank you.
Thank you, Kala, for that. That was great. As I said, please, if you have any questions in the audience, you can type that down in the chat box, and then we'll ask at the end. Next, we have Emblem Health. So I'd like to introduce Samantha Hayes. She has been with Emblem Health for 4 years. She oversees the day-to-day account management for all New York City accounts, ensuring that all New York City employees have access to care. So I'm sure that's a large job, so thank you, Samantha. So without further ado, I'd like to introduce Samantha.
Thank you. Thank you guys for attending today. So I'm going to quickly go over the benefits that are offered from the City of New York for Emblem Health. So if you want to go to the next slide, we have a number of programs that we offer. I'm going to focus on 2 of them that are our most popular, the HIP HMO Preferred and the GHI CBP plan. These are plans that you might be familiar with. You might already be enrolled. Just a reminder that the month of October is open enrollment. So if you wanted to make any changes, you may do so this month, and that would be effective for the next year. You can go to the next slide. So I'm going to go over these quickly because there is no changes from the previous year, but this will just be serve as a reminder of what the benefits are available. So we offer the HIP HMO Preferred. This is also referred to as the HIP Gold program. I'll get into a little bit more detail about what wellness benefits have been added when we reimagined the program and added the Gold card. You know that you're in this program if your ID card for insurance is gold colored. So that's the easiest way to tell. So on this plan, you choose a primary care physician. There's only in-network benefits. When you choose a primary care physician, they're either going to be preferred or non-preferred. So if you choose a preferred primary care, it'll be $0 copay for all of your visits. That includes primary care and specialists. And if you choose a non-preferred provider, your copays are going to be $10, again, for primary care and specialists. Our in-hospital copay is $100. We also have centers of excellence, Memorial Sloan Kettering and Hospital Special Surgery. If you utilize those facilities, it will be a $0 copay for the in-hospital. Emergency room is $150, and it's waived if you're admitted. Urgent care is $50. And emergency room is $150. There is optional riders that are available on this plan. So one of them is durable medical equipment and private duty nursing. The other one is prescription drugs, and you will be eligible for prescription drug benefits if your welfare fund does not provide those for you. You can move on to the next slide. Okay, so I'm going to spend a little bit of time on this slide because this is the wellness benefits that are available to all of our HIP HMO. First of all, there's a dedicated gold line with specially trained agents. So when you call the customer service number on the back of your card, there will be a live customer service representative that answers. They can help you answer your benefit questions, request new ID cards, help you find a doctor, help you book an appointment, and also give you access to our care managers. So as part of our wellness program, we offer health coaches and care managers to all of our members at no cost. This is a voluntary program that you can enroll in by either calling the dedicated gold line or signing onto our website and filling out a questionnaire through there. So our health coaches take a holistic approach to helping you achieve your actionable wellness goals. So if you want to make changes to your activity pattern, your nutritional intake, your sleep, your stress management, they are there to help. We also, they are also there to help if you have any ongoing health conditions that you need help managing, such as asthma, diabetes, heart disease, or COPD. If you have recently been in the hospital or have a more serious health condition, we also have care managers that are available that will be dedicated to helping you navigate the plan and navigating your treatment. Also wanted to mention that when you are on this plan, you are automatically entered into drawings when you get your flu shot, when you go for checkups, when you fill out the questionnaire on our website. So that is available. If you get a call that says you won a gift card, it's true. So we have 20 winners a month and then one grand prize winner for the year. And then I mentioned on the other slide about the $0 copayments at Centers of Excellence. So again, for oncology, that's Memorial Sloan Kettering, and for orthopedics, that's Hospital Special Surgery. You can go to the next slide. This is the other option. Again, both of the plans that I'm talking about are $0 copayment out of your paycheck for the base plan. So this is the GHI CBP plan. You know, if you're already enrolled in this plan, if you have received 2 cards, one for Empire Blue Cross Blue Shield and one from Emblem Health. So I'm going to go over the Emblem Health portion. B handles the medical services, Empire handles the hospitalization. So primary care is 15, specialist is 30. Again, urgent care is 50, and emergency room is 150. On the Blue Cross Blue Shield side, the inpatient hospital is 300. There's also out-of-network benefits on this plan. So if you use a provider that is not in our network, you will have a deductible and you will be responsible for the entire bill, but we do pay a portion of the services provided back. And on this plan, the optional riders is an enhanced non-participating provider schedule. So this is to lower your costs when you use an out-of-network provider in a hospital setting. And then there's also the prescription drug plan. Again, that's only available if you are not provided prescription drugs through your welfare funds. Okay, you can go to the next slide. Okay, I'm just going to go over this real fast. This is the prescription drug rider. We offer Smart 90 for the GHI members. This is a mandatory benefit. For HIP HMO members, this is voluntary. Basically what it means is after you receive 2 fills of a maintenance medication that you are required to either go through the mail order through Express Scripts, or you can get a 90-day supply through Walgreens or Duane Reade. And then the copayments are listed on the slide, and they're also available on our website and through the link. So I'm not going to spend too much time on that. You can go to the next slide. Advantage Care Physicians. So this is our provider offices that we have throughout the city. There's 38 locations throughout 5 boroughs. In the Bronx stocks, they're referred to as, in the Bronx, they're referred to as Bronx stocks. There's $0 co-payments when you choose one of these providers as your primary care on the HIP plan. If you're using an Advantage Care physician on the GHI side, it's also a $0 copay. Just a side note, Bronx stocks is not $0 for the GHI CBP members. And you can check out on their website, acpny.com, for which specialties are in each location, and all locations have primary care. And go to the next slide. I just also want to mention neighborhood care. You may have seen a freestanding facility that says Emblem Health Neighborhood Care. These are also part of most of our ACP&Y centers. This is an in-person customer service support. So you can go to these centers to speak with the person face-to-face, to answer any questions about the benefit plan or any claims that you have. They also offer a wide variety of classes and seminars, including yoga and nutrition classes, things like that. So during this time, definitely check the website out to see which locations are open and utilizing in-person services, and they also have some virtual services at this time too. You can check out on our website. Next slide. I just also wanted to mention the member portal. This is an area where you can see your benefits, your claims, your requesting new ID cards. You can pull a temporary card here. So just a good reminder to go to our site, emblemhealth.com/city. At the top, sign in to register. The next slide. And if you're looking for a doctor and you are not currently enrolled, you can also do so by going to our website and using our Find the Doctor tool. For City of New York employees and retirees, you have to scroll down pretty far on the page until you see that listed, but then all of our plans are there, and you can click on the plan that you would like to look at the network and search for providers there. And then these are the, if you are a prospective member and have questions, there is a number 800-447-6929. If you are currently a member and have additional questions, these are the numbers on the back of your ID cards. They're also located on our website if you need them. And thank you guys for your time.
Great, thank you, Samantha. And just a reminder, so I know that was a lot of information with phone numbers and links and everything. As a reminder, if you go into the shared file, you go into Emblem Health folder, you'll get a PDF version of that presentation. So you can just click on the links or you see the phone number, so we make it as simple as possible. And then lastly, we have Gail Bauer from NYC Well. She's currently the assistant program director. She holds her MSW for Columbia University of Social Work, and she has over 15 years of experience in the crisis intervention and information referral services sector. So Gail, thank you.
Thank you, Daniel. Hello, everybody. So many of you may have heard about NYC Well. I'll tell you a little bit about our overview. I'm going to talk about what it is, who NYC Well is supporting, why they're reaching out to NYC Well, and how they are accessing NYC Well. Next slide, please. So you may recognize this picture. NYC Well, at least before we all had the orders to stay at home, you would walk through the subway, you would see a ferry, a bus, and NYC Well was plastered everywhere. Rightly so. We are the front door to mental health services, as Carla had mentioned. We are the place to call when you're looking for support and services for yourself or a family member. NYC Well has been around for about 3.5 years now. Prior to that, you might be familiar with LifeNet, which had been around for about 20 years prior. NYC Well kind of took LifeNet and made it way better. So we are a free confidential service. We are available 24/7, 365 days a year. We can be reached by talk, chat, and text. We have counselors who speak English, Spanish, and Mandarin Cantonese, but we can also accommodate up to 200 languages using the language line. We've always had counselors, but when we became NYC Well, we added peer support specialists. These are individuals who have lived experiences. You know, sometimes it's helpful to talk with a counselor, but sometimes it's helpful to talk to someone who kind of gets it, who knows what it's like to come out of an emergency room and get back on your feet, or to be diagnosed with a mental illness and have to tell your family members, and just to talk with someone who maybe has not walked exactly your path, but knows the anxiety, knows the challenges, knows how difficult it can be. So that was an amazing complement and addition to the services we were already providing. NYC Well is the mobile crisis team single point of access. So there are 24 mobile crisis teams around the city. In order to access them, you have to come through NYC Well. So if you are looking for a mobile crisis team, you would call NYC Well. But sometimes people call us and they don't know what they're looking for, and we might identify mobile crisis as being an appropriate intervention, and we're going to tell you about it and process that and have a team come out to your home or the home of someone you're concerned about. So the next three are those things that we do to try to make it easier to connect to care, right? We're the front door to mental health services, but it's not enough to just give you the names of places. We want to make sure that those places actually work out. So if you call us during the day, we're going to offer you the option to be warm transferred to one of the referrals we gave you. We're also going to give you the option of a follow-up call to make sure that those resources worked out. That's for our high-risk calls, right? People who are in crisis. We want to make sure that those resources worked out, and if not, we want to work on a new plan. And then our public-facing services finder is the fancy way of saying that our database of 2,000 resources is on our website, so you can go and search our website and look for resources in your community. Next slide, please. So who's contacting NYC Well? About 85% of the people we hear from via chat, text, and phone are the identified client, the person reaching out for services or help for themselves. 7% are service providers. That could be physicians, case managers, substance use personnel, and then 8% are friends and family who are concerned. So far, in 2020, we have had people reach out to NYC Well over 300,000 times. We get over 1,000 contacts a day, so certainly the place to reach out. Next slide, please. So why are they reaching out to NYC Well? Here's a breakdown of how many of our contacts are people reaching out to speak with a counselor versus peer specialist. But then we take note of what people are reaching out for. And interestingly, I've been doing this presentation for a good couple of years now, and in the last 7 months, since COVID happened, anxiety has gone from typically being in the 4th position to being in the 1st, the presenting problem being at the top of the list for the last 7 months, which I don't think is a surprise to any of us. Next slide, please. So how are they reaching out to us? So the longer I've done this presentation, the more I see that blue part of the pie getting smaller and smaller, right? I've been with the agency for 14 years, and I answered LifeNet, which was the predecessor to NYC Well. I answered the phone for 8 years. The addition of chat and text is so crucial. It's so important that we are able to be there for people in the way that they need it, especially now, right? As people are, we've had stay-at-home orders, we have people who are staying home out of choice. We're all on top of each other. It can be hard to have that private space to reach out. I think of that parent who is sitting on the couch next to their child who's doing math homework and is feeling so overwhelmed. She or he is not going to pick up the phone and talk to an NYC Well counselor right there, but she or he can pick up a computer and have a chat conversation in the middle of the living room and no one will know about it. Next slide, please. That's the end of my presentation. It's always a surprise. Thank you very much.
Well, thank you, Gail. I appreciate that.
Sure.
And you know, you end right there, but we're running to our Q&A, and actually, Gail was wondering if you could ask, so if everyone could bring back their videos so we could see everyone. So this will just be, you know, imagine we're just sitting around a table and having a discussion. So feel free, or anyone, to jump in to give their point of view or opinions. But Gail, I wanted to first start with you. So, you know, the reason why Work Well did this Karen and Coping series is that we're obviously, you know, through a lot of different events right now, dealing with a lot of stress. So my question for you, Gail, is kind of just, you know, what are the particular struggles do you see through your work, or just in general, that New Yorkers are experiencing right now? And, you know, why is it so important for us to be aware of these different resources for our wellness, mental health wellness, physical wellness?
Sure. Yeah, there's a lot going on right now, right? The COVID pandemic, racial unrest is more prominent in the news, and upcoming elections, it is a lot. And at a time when we would probably benefit from that connection with family and friends, we've been limited due to social distancing and stay-at-home mandates. There's a loss of routine. Things seem very up in the air. People are dealing with a loss of employment, financial insecurity. Some people are dealing with grief. Many New Yorkers have lost family members or have had COVID themselves. There's the stress of being an essential worker. There's the stress of working from home with multiple family members in the home. The stress for parents juggling work responsibilities while managing their children's education and their children's anxiety. So much uncertainty, just a lot to be dealing with. And I actually have on my notes, I have anxiety in capital letters, but I spoke about it already. I think that's definitely the overarching theme in a lot of our contacts. Add to all of this the disparity with which this is affecting Black, Indigenous, and non-Black people of color. It is just a tremendous amount for city employees and city residents to be dealing with. So your second question, why it's important for us to be aware of this. It's so important we understand how this is affecting us and how these wellness and mental health resources can help. Experiencing this level of stress for 7 months with no clear end in sight can really take its toll. Stress affects everyone, and ongoing stress can cause or exacerbate serious health problems, including mental health problems. But it's so important that we know that, yes, we're all dealing with stress, some more than others, but there are ways to manage our stress, and it's important that we feel empowered in order to do that. And connecting with these wellness resources that we're talking about today is such a good first step.
Great. Thank you, Gail. Yeah, and I think that was well said. And, you know, our message here is that, you know, we're all going through this together, and this is why we're having programs like this, to show that we're in this together, and, you know, that there's a myriad of resources available for anyone that may be struggling. With that movement, I would like to say, Kala, there's been a specific question about how this may be, these particular challenges, COVID especially, and isolation, may be impacting older adults. So what are the difficulties that they may be experiencing? Just unmute, please.
Yeah. So older adults, you know, everything that Gail mentioned, think about all of those, and think about older adults who are trapped in the house right now and being told, constantly reminded that you're at high risk for this. Now, prior to COVID, regardless of whether this youth-obsessed culture kind of erased the presence of older New Yorkers, older New Yorkers were very present in our communities. I don't know how many of you know this, but many, many soup kitchens in the city and food pantries are actually, all the volunteers who support this are mostly older New Yorkers. So they were very vibrant, and they were involved in providing volunteer services. They were also attending senior centers, taking place in classes, supporting other people, caregiving grandchildren, in the workforce in many ways. So these were contributing amazing, amazing people. And now suddenly, as COVID hit, their children are no longer able to visit them. For those who are immigrants and whose children are elsewhere and were coming to see them can no longer come to see them. They are trapped in their homes. They're constantly seeing media about people in the age group who passed away in nursing homes. They're not able to meet with their friends in the diner down the block. So this has created profound isolation in seniors and in older New Yorkers. And I don't know if most of you have seen that the CDC recently released a report on the impact of social isolation on seniors. It increases their risk for heart attack. But social isolation can increase someone's risk for Alzheimer's almost by 50%. So these are very grievous statistics, right? You can get more depressed, your physical activity stops, you start to develop heart problems. So a number of things are caused by social isolation. So, and with sort of the uncertainty ahead, as people are facing sort of their mortality and loneliness, what can they look forward to? So this is a difficult time for seniors in our city. And like the Department for the Aging, a number of services that they were providing, they had to pivot really quickly. But not all of our older New Yorkers have access to, are familiar with being online, or familiar with being able to take advantage of what's there. So the city has put a lot of thought and work into how we can support them.
Great, and just to follow up with that, so if we know someone knows an older adult that is struggling, does Thrive support programs for older adults? And if you could speak about those programs.
We do. There are two very distinct programs that Thrive has fostered and supported from the beginning. One of them is the Geriatric Mental Health Program, and this is specifically started with placing clinical social workers and clinicians in 48 senior centers around the city. They do a number of activities, including providing therapeutic services, counseling, long-term and short-term. They also engaged a number of New Yorkers in conversations, increased mental health literacy, played games around mental health with them, specially designed games around mental health with them. So they really engaged older New Yorkers in conversations to improve mental health and resiliency. With COVID, all of these services have pivoted to being on the phone and online. They continue to provide all these services, and just in 2020 alone, I think over 1,000 seniors received in-depth clinical services, apart from all the other things they do. The second program is really to work on the social isolation, and it's called the Friendly Visiting Program. And this program there are 15 such programs throughout the city. And in this program, trained and screened volunteers are actually connected to older New Yorkers to provide one-on-one visiting services. So usually before the lockdown, they were being visited at home by volunteers. And as part of this program, the volunteers really focus on the strengths of the older New Yorkers. Sometimes it is the senior who's teaching the volunteer how to speak English, or how to paint, or how to make jewelry. They cook together, they walk together, they watch movies together, discuss politics together. So suddenly for this person, there is actually someone who's coming specifically for them. And it's not just there to provide services or look at the deficits in their life. This is somebody they share, and they truly become friends. And these relationships and friendships last for years. And if you hear the stories of these relationships, they're truly, truly moving and touching. And this is a very important service. And again, over 1,000 seniors receive friendly visiting in a year. Now, with COVID, these services continue to be provided, and they're much more robustly provided on the phone, because people are not able to visit. They call much more over the phone. They're also developing other strategies online to meet these needs. And if you know anyone who needs any of these services, you can go to DFTA website at DFTA, and you can call Aging Connect. And they will connect you or anyone you know who may need any of these services to the appropriate person. Also, if you want to volunteer, it's a great opportunity to volunteer for the Friendly Visiting Program. It is an opportunity that gives as much as it gets. So if you or anyone you know would like to volunteer, please do so.
And that was the Friendly, what was it volunteer for? Sorry?
Visiting program?
Okay, Friendly Living Program.
Friendly Visiting, Danielle.
Okay.
Visiting, Friendly Visiting.
Friendly Visiting.
And ask for that. They can ask to be a volunteer, or ask to refer someone, or ask to be connected to volunteer.
Great. Well, thank you, Carla, for that, and thank you for Thrive NYC for handling all that excellent programming. We'd like to move on just to, I saw a question, and I've been aware of this for Patricia, in the lines of, I've heard, and we've all heard, the particular challenges that cancer patients have been experiencing with the onset of COVID. I know that people had a delay treatments. I know even now that I can't even imagine people that are seeking treatment or maybe doing chemo, they can't have a family member or a loved one with them. There may be some rules where they can't have someone coming in. So I was hoping maybe you could just speak a little bit to the challenges that cancer patients and their loved ones may be experiencing right now during this time, and maybe some of the resources you know of through cancer care or other ways that they can transcend these challenges.
Certainly happy to, and many of the challenges and issues that my colleagues who spoke previously talked about are the same for cancer patients, with a couple of buts. I would say in a general sense, what COVID has done is put challenges, issues, and concerns about cancer on steroids, but it's also created some very, very new challenges. So first, in the early days of COVID, one of the challenges that we saw that patients were encountering was the quest for credible information. They didn't know whether they should wear a mask. Some people said some advised they should, others said they shouldn't. They weren't really sure how safe they would be going to treatment. That was a major concern for individuals. In addition, and especially in our great city, many individuals relied on mass transit to get to and from their treatment, their scans, their lab work. There was a great concern, for obvious reasons, about being in a subway, being on a bus, or even being in an Uber. Then you add that to all of the compounding challenges of suddenly a parent who's undergoing cancer treatment has their children at home. Their whole infrastructure for caring for their child was completely upended at a time when potentially even their life and their career was upended. For some, they still had to continue to work with no resources to care for their child. Then you had many individuals that lost their job, their only source of income. Let me just tell you about a couple of stories that I'll never forget. A young woman called Cancer Care in May. She was a single parent, 3 young children under the age of 10. She lost her job. She lost her health insurance. She told us that the only thing she had in her refrigerator was 1 slice of American cheese, and her well was polluted and she couldn't afford water. We had another individual undergoing active cancer treatment who also lost their job, their health insurance. Her beloved mother was hospitalized. She couldn't see her. Her mother passed away from COVID and the body was lost. These are extreme stories, but they tear at the heartstrings. So we as an organization since COVID have created financial assistance funds and programs. We've raised over $4.1 million to provide grants to individuals to help with groceries. Food insecurity was one of the biggest issues that we heard. We raised a lot of financial assistance. We created a very novel program with a large organization called Community Oncology Alliance that represents thousands of community oncologists across the country. We contracted with 2 transportation companies that committed to provide medically safe transport, meaning cars were sanitized, drivers were masked and gloved. We have so far transported over 10,000 cancer patients to and from treatment since April. So my recommendation is reach out to Cancer Care. If we can't help you, we'll find something that can help you. We're well connected across the country, and you will hear from, the phone will be picked up, and you'll hear from someone who cares and is there to help support you.
Thank you, Patricia, so much for that. We really appreciate those resources and that insight. And then lastly, so we have a couple more minutes. Samantha, we've received a couple of questions. I guess I'm trying to cohesively put this together. It seems like one is, it's just kind of like, and it might be a rough question, but like, and I guess you probably get this a lot, is which should I choose, HIP HMO or GHI GBP? And it's, I guess, if you have an answer, is there pros and cons of both? Is it recommended for certain groups over others?
Yeah, so the biggest difference between the plans is the HIP HMO is, again, in-network. So we're in Connecticut, New Jersey, and New York. And the CBP plan is there's a national network. So we have providers throughout the country. The difference is the co-payments are lower on the HIP HMO plan, but on the GHI CBP plan, you have out-of-network benefits. So it just depends on the doctor you would like to see, if they are participating in any of the networks, and where you live. If someone's out of state or out of the tri-state area, the CBP plan would be better. If you're in New York, there is, we have a very large network, and you can control your costs a little bit more if you're using that HIP HMO. Also, the wellness benefits are only available on HIP HMO, the care managers and the health coaches that I mentioned before.
Great, thank you, Samantha. And we just have time for just one or two more quick questions. One for Patricia with Cancer Care. There was a question about with the social workers. Is there a way that someone can be matched with a social worker? Is it based by where they live? And especially how is that done virtually?
When an individual calls our Hope line, an intake is done by the social worker that is answering the phone. And then depending upon what service is needed, if an individual requires counseling, as an example, or requests individual counseling, they will be likely matched up with a social worker that not only has availability, but has expertise in their disease or in their issue. So we have social workers that are expert in working with children. We have social workers that are expert in working with the bereaved. We have social workers that are expert in specific diseases. So it just all depends upon the need of the individual at the time that they're calling.
Great, thank you, Patricia. And our final question for Gail. Are there any limits for a person using or contacting NYC Well?
Any limits?
Yes.
No, not at all. And I'm not exactly sure what you mean by limits. We are free.
I guess are they only allowed 3 calls or 2 chats? Yeah.
Oh gosh, no. We have people who call once and they get what they need. And then we have people who are going through a crisis, and it's not a one and done, right? You might get some resources and then things change and you call back and you get more, or things are just not going really well and you make 3 calls in a week. It's all about what that person needs, and we are there in the moment to figure out what is beneficial and helpful at that time.
Great. Well, that's pretty much it for the time here. We have a couple more minutes. Yes, Tali, you had something to say?
Yeah, I wanted to say that we didn't have time today to talk about other Thrive resources because the slide deck was limited in its number. But I just wanted to alert you all that when you get the PDF with all the resources, you'll see that Thrive has pulled together a number of toolkits and resources that have mental health resources for children, teens, youth, justice-involved individuals, and for faith-based and community leaders. All of these not only support access to mental health care and give you a ton of information about mental health, but also provide you with tools for resiliency and well-being.
Great, thank you, Kyle, I appreciate that. Well, again, Gail, Patricia, Samantha, Kyle, thank you all for your time. We really appreciate you coming to give these valuable resources, and I hope everyone that was viewing was able to take away some valuable information. I'm sure I did. So you could just sit back and relax. We have just a couple more slides I have to go over just for our participants. So just for the next day, so thanks again for participating in our Karen and Coping 1 activity, but we have plenty of more. We have a day 2. We also today at the end of at 5 p.m. is a paint and relax. So you can go to the on.nyc.gov/Karen Copin. We're putting that in the chat right now, that link. But then we also have tomorrow a day of activities. We have yoga and meditation. We have a second wellness vendor fair. So it's the same format, different group of people. So tomorrow we have actually deferred comp, WW, EAP, and Metro Plus. So if you want to learn about any of those, come by, ask questions like you did today. At 11 a.m., we have a landscape of gender-based violence during COVID. So unfortunately, we've seen a rise of gender-based violence during COVID-19. So we'll explore the reasons behind that and also how you can help provide assistance for someone that may be experiencing domestic violence, and just learn about the numerous resources out there. We spoke a lot about how we build mental health resilience and the importance of that. So tomorrow at 12:30, we'll have a live Q&A about that to learn how we could deal with stress during these times. And then at 5 p.m., we'll have a color and chill to come, meet with colleagues, do some coloring, and it's just a way of connecting. We're talking about a lot about isolation, so this is a way of sitting down with your fellow colleagues and just doing something relaxing. We have just general upcoming WorkWell NYC events. So on October 28th, we have the Let's Talk Workplace Accommodations for Mental Health Disabilities. So we're going to be talking about what is a mental health disability, accommodations that employers can provide for people that may have a mental health disability, and just resources to help out with that. We also spoke about race equity in this. So we have NYC on Matters of Race Equity on November 6th. That's presented by the City Commission on Human Rights. We're going to talk about the city's position on racial equity. And it's going to be an opportunity for participants to share their ideas and thoughts on how we could work to end racial discrimination and build solutions that engage the entire NYC community. So really exciting, so please join that if you can. And lastly, on November 12th, we have the Eat Well Q&A, Preventing and Managing Diabetes with Food. So learn the relationship